Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, I'm going to cover two main reasons that I have seen in my private practice why individuals tend to experience reversed dysphoria. And I'll tell you what exactly reverse dysphoria is in case if you're not familiar with it. Before we begin, make sure you're subscribed to the channel and make sure that you also see that I have a free book below, link below, and make sure you join and follow me on Instagram because that's where everything is happening. That's where I post the most. Okay, now reversed dysphoria. What is reversed dysphoria? Well, if you think about dysphoria as feeling that sense of incongruency, as feeling that sense of disalignment with your gender and your gender assigned at birth. The other way to look at it is your authentic sense of self and with your gender assigned at birth. And as a byproduct of this disalignment, you're experiencing dysphoria, which is a psychological distress. It's a psychological symptom, if you will. It's a way your body and mind is letting you know that something is not matching up. When you're experiencing dysphoria, and I know that a lot of you are very familiar with this, it is incredibly uncomfortable. For a lot of you, it is very destabilizing and very painful. What happens is you go out there in a world and you internally feel one way, and yet the rest of the world externally sees you, responds to you, communicates to you based on what they see, and what they see is you gender assigned at birth. So, as a byproduct, you experience a tremendous amount of social dysphoria, a lot of physical dysphoria as well. Now, reverse dysphoria, think about it. What is that? Well, reverse dysphoria happens when you start going through gender transition, whatever that may be for you, and perhaps you are already on hormones, and perhaps you're already having some changes. Maybe you're starting to present in your authentic gender. Maybe you have only started social transition. Reverse dysphoria doesn't necessarily happen only when you've been on hormones for X amount of time, or only when, for example, you are already fully presenting. It can happen in the very beginning stages of your gender transition. It can happen when, for example, you're just out, when you're just sharing your pronouns and you're sharing your preferred name. Reverse dysphoria can also happen then. So I want you to realize that reverse dysphoria can happen at any point of your gender transition. So reverse dysphoria is when you're now stepping in, you're leaning in, you're showing up, you're taking steps, you're doing things, you're doing the work in order to get aligned to your authentic gender. And instead of feeling affirmed, supported, confident, feeling less dysphoria, less anxiety, less depression, you're feeling now reverse dysphoria, meaning now you're experiencing discomfort and distress when you are moving through life in your authentic gender. Again, now you're experiencing a lot of psychological distress when you're moving through life in your authentic gender. Reverse dysphoria can feel like one ginormous mind fuck. Pardon my French. There's no other way to say it. And the reason why it feels like one ginormous mind fuck is because here you are, you're taking the steps that you have been told either by professionals like myself, other professionals, maybe your therapist, your provider, your psychiatrist, your endocrinologist. You've heard numerous accounts of individuals taking first steps and feeling alleviated. And yet here you are, you're doing exactly what's been shown to work, and yet it produces the opposite results. And no wonder it feels like a mindfuck, because it spins a lot of you in a state of not only out of control, but in a state of deep despair, because a lot of you start questioning and freaking out. For those of you who are anxiety prone and already prone to rumination and catastrophizing, this is incredibly challenging for you, because now your mind is running loops, trying to figure out, why do I feel this way? Now you're asking yourself, am I making a mistake? Am I really not trans? Who am I then? So, in other words, remember gender crisis that happened for so many of you. The other way a lot of you like to express it is when you act correct. It almost feels like your act has cracked all over again. It's like act cracking 2.0. And now it's even that much more devastating because you ideally should be moving in the right direction. That's what reverse dysphoria does for a lot of you. And it's so destabilizing. A lot of people during this point just give up. They stop taking hormones. They stop doing any gender related steps. They stop even seeing their therapist. I had clients who stopped seeing me because this has happened. And it's not only months have passed until they reach out back. And I realized this is why they dropped out, which prompted me to also make this video so that you can understand two main reasons why this happens. And that understanding can help you make a better decision before you decide to call it quits. So, two main reasons why reverse dysphoria happens. Reason number one, and I want you all to listen very careful to reason number one, because reason number one happens, I would say, I'm going to put it in an age group because age matters. For adults who age 30 and up. Let me take it a little bit down. 26, 27 and up. Reverse dysphoria in this category that I'm going to tell you is the first reason why it happens 95% of the time. The younger you are, and especially if you had no childhood onset of gender dysphoria, then you may potentially be in category number two. Also, category number two is very rare in my experience. So, number one reason why reverse gender dysphoria happens. You're moving too fast in the right direction. Let me say that again. You're moving too fast, but you're moving in a right direction. Now, let me give you an explanation so that in case you experience reverse dysphoria, you don't throw in the towel. One of the reasons why you experience reverse dysphoria, it's beyond just moving too fast. But what happens when you move fast is this. There's lack of internal integration, lack of internal assimilation, meaning you're changing, you're taking up steps. Some of you might be even implementing too many things at once. I know that for a lot of you who are older, whose act cracked later in life, there's this feeling of FOMO. Oh my God, fear of missing out. And there's this need to do everything at once because you're thinking about the years you have left and you don't want to waste a single day. So when we take on too much, when we come out all of a sudden to everybody, when we start hormones immediately, when we start presenting immediately, your mind, your internal psyche, that internal authentic self hasn't even caught up yet. Because it hasn't caught up yet, a lot of things happen, including reverse dysphoria. Another reason why reverse dysphoria happens when you're moving too fast in the right direction. Again, I'm going to emphasize in the right direction because I want you to realize you're still moving in a right path. But you know what? Sometimes even when we move toward the right path, things do happen. So the second reason why this happens when you're moving too fast is you have not processed all of your fears in relationship to what gender transition entails. Again, you have not processed all of the fears, or as many as you can acknowledge experiencing in relationship to gender transition. Many people feel like transition is going to be a walk in the park. Many people have a fantasy, I would say, unrealistic expectations about what hormones are going to do. many people have a lot of their own ideas or ideas they pulled from internet. And they get so many of you get so wrapped up in excitement, you lose the capacity to really tap into your fears. A lot of you don't want to acknowledge your fears because then you fear that acknowledging your fears is going to prevent you from moving forward. But a lot of you undeniably are going to have fears. Fears are normal. If I see a client that doesn't have a fear, to me, that's a red flag. Fears are natural. If you're not afraid of this big change in your life, well, then I look for some other signs of things going on because this is a big red flag. Anything in life that is big and life-challenging and changing and altering the way gender transition is always going to be accompanied by fear. You're not looking for absence of fear. You're looking for presence or rational presence of fear that within the context of what you're going through. And a lot of you have not acknowledged your fears, including your inner transphobia. Am I going to pass? Are people going to think that I look like a freak? I'm using your words. Are people going to think that I look like a man in a dress? Will I be ugly? Will I be not manly enough? Will my voice give me away? What if I lose my job? What if everybody leaves me? What if I end up all alone? What if my safety is jeopardized? There's so many fears that are byproduct of the world you live in that you have not yet fully addressed. And so when you take steps in the right direction and you're moving too fast, you suddenly confront those fears because you're out there, you're living your life, you're presenting. And for the first part, it feels wonderful, but then you get one person say something negative, and your whole castle, if you read my book, your whole castle of blocks of confidence comes crashing down. And that's when you feel incredible sense of reverse dysphoria. The third little tiny category within this big category, why it happens for you when you're moving too fast in the right direction, is that even if you did process the fears, you don't have adequate coping skills and tools to deal with challenges when you run into them as you go through gender transition. This is where working with somebody who is at least somewhat specialized in this, ideally specialized in this, is going to be so worth every single penny, because this is what, for example, I'll use myself. This is what I do. It's my job to anticipate based on your circumstances and based on whether you have processed things or not. It is my job to anticipate challenges that are going to come up for you, depending where you live, depending what surrounds you, depending what your personality type, depending whether you're prone to anxiety or depression, depending on so many other factors. And to anticipate those challenges, and before they even happen, to equip you and give you tools so you can handle them, including warning and letting you know this is going to happen. We need to watch out for this. The number of clients I have that I work with, when this happens and they tell me, oh my God, I'm so glad you warned me about this, because now that it's happening, it's not freaking me out as much. So this is a group where you need to also be equipped. And if you're not equipped with the right tools, if you don't have resources, you can't afford to work with somebody specialized, at least start preparing yourself to acknowledge that challenges are going to happen and start preparing yourself to anticipate them and start to normalize for yourself that when the challenges do happen, you'll find a way to handle them. Because trust me, if all of you have been able to handle gender transition for this long, you can handle it too. Okay, so start anticipating. I always tell my clients, My job is to prepare for damage control. I want to do any possible damage control on all angles right now, not when it happens. Because honestly, it actually makes my job easier. Last thing I want is my clients calling me during my off hours because shit just hit the fan and they weren't prepared for it. So at least start anticipating that things are going to happen. And trust me, shit is going to hit the fan. Sorry, I'm like full of foul language today. Okay. Now, this is the first main reason why reverse gender dysphoria happens. The second group, like I said, happens very rarely, in my experience at least. If it does happen, it happens with people who are younger adults who also have not had early onset of gender dysphoria. Why do I cluster this together? Because younger adults today are so inundated with gender lingo, gender all over in society. They're understanding that gender is not just anchored to your sex. And as a result of this understanding, they're exploring, which is wonderful. But as a result of exploring, sometimes people think that this is their identity when it may turn out not. This is why I'm pinpointing younger adults, younger generation, together with not having onset of gender dysphoria in childhood. It also, the second category, very rare, but can also happen to individuals who struggle with other severe things going on in their life, perhaps a severe history of trauma. Maybe they have some kind of clusters of personality disorders or mood disorders. This is when people are moving too fast, but they're moving in a wrong direction. Again, very rare. What does it mean you're moving too fast in a wrong direction? Just that. You're taking on a lot, you're moving forward, but you're not moving forward in the direction you need to be moving. Now, having said that, that does not mean that automatically means you're not trans. It could mean that whatever steps you're taking, there's some, maybe one or two, or maybe three of those steps out of 10 are not meant to be part of your gender transition. Remember how I always say, surgical and medical is not mandatory. So it could be that for some people, is as their gender dysphoria unfolds, gender identity unfolds for them, they figure out that maybe they're not as binary on a spectrum, but more land somewhere in between, or maybe they're identify as more fluid. And if you jump too fast in the hormones and later realize that you only wanted to microdose a particular hormone, that could produce reverse gender dysphoria as well. So I want to be careful here. It does not mean necessarily that you are making a complete mistake. There are a very small percentage of people in my experience that genuinely realize, oh, this is just, I thought this was gender identity issue, but it's not. But for some people, it could be that your identity is still shifting. You still need to figure it out. It's a sign in this case that you need to stop and you need to assess your steps. The difference between category number one group and category number two is category number one people feel more like this. It's more the certainty of this makes no sense. I know I'm trans. I know I've been dealing with dysphoria for many years. So why do I feel this way now that I'm taking steps I need to take? Second group, it's more, it's different because you don't have that almost early years of dysphoria to bank on. And so it feels different. In either case, both groups should always assess things for themselves. Stopping and assessing things and just looking around and asking yourself is part of the process. You need to be prudent. You need to be prudent. You need to pay attention to things. But this is why second things happen. People moving too fast and not in the right direction. Or there's something about the direction they're moving that needs to be, their navigation system needs to be modified. Maybe they need to take a different route. All of this is important to take into consideration. But these two main reasons why reverse gender dysphoria happens. And the first one, again, happens, in my experience, majority of the time. Hopefully by now, those of you who experienced it can understand why it has happened for you. If you have never experienced it, At least you now have an understanding that this might happen. And when and if it does happen, you can say, oh, I remember watching Dr. Z video. And I remember this is why she said this might happen. And that this is part of it. And then you can work on internal integration, confronting your fears, and getting the skills that you need in order to overcome challenges. Comment below, let me know if you have experienced reverse gender dysphoria. I know that it is very common. It's starting to become even more common for a lot of people. So comment below, share what your experiences have been, share what you're hoping has been with it, and I will see you all next time. Goodbye.